everybody. Nice to meet you. I'm Heidi Hadley and this is Total Somatics. So thank you so much for joining me today. I look forward to spending a few moments with you today. We're going to go through a bit of what somatics is all about, and then the most important thing is I'm going to get you, if you can, to get down onto the floor, and I'm going to talk you through a somatic exercise, and we're going to put a bit of mindfulness into that too. Okay, so just a few things before we start, and just to allow people to log on as well, is that obviously I'd like to discuss a bit of what somatics is about and then also go through the practical side of things. So if there are any questions, can we leave them towards the end if that's possible, please? Another thing is, as it's 6:30 in the morning here in Australia, the parrots have started. So even though I want it to be a very quiet mindfulness session a bit later on, I'm very sorry if you hear a lot of squawking. Can't do much about that, so sorry about that. Okay, so let's talk about somatics. So somatics is a mindful movement therapy, and somatics was created by Dr. Thomas Hanna many years ago now. And what Dr. Thomas Hanna discovered is, and really what neuroscience has come to support in recent years, is that the mind and body are very closely connected. And that's where Thomas brought the name somatics into it, because somatics comes from the Greek word soma, which means the whole body. So you can see we can't really separate the two. Okay, so think about it in this way. When we have any physical pain or any issues with our body, it does affect our emotional and mental health. And likewise, if we have any emotional or mental issues or concerns or stresses, that has a direct effect link and a cause on the body. So I'm sure you can think of many times in your life where this has actually happened. So you can see the relevance and see how that somatic awareness comes into all areas of our life. Okay, so somatic exercise is there to re-educate your muscles to work again in a correct manner with your brain. So the purpose of somatic exercises is to break this habitually contracted tight muscles that we've created from like learned behavior, as it were. So some examples of this could be a past injury. So I'd like you to think about, say we've broken our left foot. For quite some time, you start to nurse that left foot by loading more through the right side of your body. And while this is happening, your brain starts to notice mechanically things are changing. So as a result, the brain's really clever and it starts to tighten and shorten the waist muscles on the left-hand side so that we start to get a bit of a leg length discrepancy. So a long time afterwards, when that left foot's healed, somebody can be left with a bit of a residue limp. And that's because basically the brain has still, well, it's basically like the new normal, as it were. It's still holding that habitual pattern. And then we can have another pose such as the workstation. So think about the workstation. There's many hours where we might be leaning forward and typing on the keyboard. Added to that now, we've got mobile devices. So we've got our head down a lot of the time looking at screens. So again, this habitual behavior starts to create more tightness through the front of the body. So we start to get more of a stooped appearance through the neck and the shoulders. And then what about if you're a grandparent or you're a parent and you're carrying a child on one hip, just because you need to get on with all the jobs in the house, for instance. If this becomes a learned behavior and it becomes a regular thing, the brain starts to notice the changes again mechanically. So what it will do is start to shorten, say we carry our little child on the right hip, it will start to shorten the waist muscles on the right-hand side, again creating a bit of a hip hitch, and we get that leg length discrepancy again. So that can cause a lot of problems in the lower back, but that can also feed up and affect into the neck and shoulders. And then we can have those repetitive postures. So I see a lot of cyclists in my clinical practice, and because of that reason, what you start to see with them is they get a lot of tightness through the front of their body. So this starts to affect through the neck and the shoulders and through their lower back. Okay, then we also find that it just becomes part of them, part of their nature. So it just becomes part of their, Frank, you know, with his limp, and Mavis with her waddle, and it just becomes part of their everyday activity. But somatics can actually help, because what we start to do is reintegrate movement back into the neuromuscular system. So I'd like you to think about, and it may be at the moment as well, but think a time when you felt in a lot of pain. So it might be in the past, it might be at the moment. I want you to think how you become quite guarded with the way that you walk. You think about it, you walk quite gingerly, don't you, or quite stiff. And there's an element of apprehension there again. So can you see where the mind and the body start working together to create almost like a caution with your movement, so you become more rigid, more stiff and concerned about pulling things. So what it does is it does create more of an anxiety, it's not, yeah, more of an anxiety really towards your movement, so that you do get quite fearful that you're going to flare up a pain or a joint or an issue. And so it becomes very guarded. So you become less physical, or you don't move as freely as you used to. So think about it, when you create this habitually, it's a habitually tight pose or walk, what you do over and over again, you create a new or a learned behaviour. And so it starts to create an asymmetry in the body. This then affects your posture. Think about that for a moment. It could be that you stoop more, or you're loading more to one side. And say you are loading loading your body to one side more, what you find is that you will start to wear the joints out a little bit more through that one side. And as a result, obviously, you increase your pain. So what we aim to do with somatics is to soften the muscle. We want to relax the central nervous system, and then also increase our range of movement. Okay, now a question that many people ask me is, what's the difference between somatics and stretching? Well, it's completely different. Somatics is a completely different modality on its own. If I just explain first of all about stretching. Now stretching, when we stretch a muscle, we basically send a muscle from, or a message, should I say, from the muscle to the spinal cord, back to the muscle. Okay, so we passively lengthen the muscle, which means there's no intelligent change to the muscle, because we're basically just stimulating a spinal reflex. That's all we're doing. Whereas when we do a somatic exercise, it involves a contraction of the muscle, a release of the muscle, and then we allow the muscle to rest. So what we do is repeat this movement over and over again. And when we do that, the message runs from the muscle to the spinal cord up to the brain. It either creates a new neural pathway, or it will reawaken a dormant pathway of a movement pattern that we had long before we started to create that learned behavior of a limp, for instance. And so that new neural pathway or reawakened pathway starts to kick in. The message runs back down the spinal cord, back to the muscle. So obviously, if we keep repeating that somatic movement, we contract, we release, we rest the muscle, we start to create that new movement pattern. We wake the brain up, so the brain thinks, oh, so I can move freely, I can do this movement. And so this is where it is an intelligent awareness of the muscle, because as opposed to this a stretch, which is just a spinal reflex, we are working at a cortical level. So we are getting the brain very much involved in the muscular activity. So this is really good, because it then teaches the muscle and tells it when it can contract and when it can relax, or some people might say when the muscle can switch on and switch off, for instance. So a really good example of showing that cortical awareness of movement, contraction, coordination could be when you learn to ride a bike, for instance. So when you ride a bike, you get on that bike to begin with the first time, and you're all a bit wobbly and you can't quite get it quite right. But the brain is absolutely amazing, because in no time at all you are on that bike, and the synapses at different parts of the brain know when to contract, when to relax. You get the balance, everything, the eye coordination with your movement. It's fascinating, the brain. Very quickly you start to be able to learn, ride that bike, and it becomes second nature. That's the same with somatics. The more that we can do this in our personal practice, the more it's going to help us in everyday life, because it becomes second nature. We start to tell the muscles and re-educate them and say, you can move like this, you can mobilize, your joints will mobilize quite freely, you can do all these movements. You've just forgotten, basically, because the brain has switched off those old movement patterns. Now, added to somatics, there's a lot of mindfulness techniques involved, and mindfulness is a huge subject in itself. So the Total Somatics program breaks it down into bite-sized pieces and makes it relevant and very, applicable to somatics. So that's where part of that 10-week program of Total Somatics is really beneficial, because obviously you can learn that in the comfort of your own home. There's tutorials, there's instructional videos, there's audio mindfulness somatic mindfulness audios to listen to. So you can pick and choose what you want to do at different times of the day. That's why I've put the Total Somatics online program for you, so you can do it in the convenience of your own home, basically. Okay, so what I'd really love to do is get you on the floor so that you can experience this somatic exercise and basically how your body's responding. So I'm going to stay sat in the chair. So while I stay sat in the chair, and this is where I'll be the whole time, I'd like you just to find somewhere on the floor that's comfortable. And I'll carry on talking while you're getting yourself settled, just so that you can check that the volume's still okay for you and you can hear me okay. Right, so as you're getting yourself settled, I'd like you to be, we're going to start with your position so that you're lying on your back. Okay, so in this position, also I want you to keep your eyes closed as much as possible. I will keep reminding you of this because it's very common for people to want to open their eyes. But we're wanting to increase the awareness or that mindfulness of our internal system and reduce the amount of stimulation that the brain will get from the external environment and the parents. Okay, so when you're ready, I'd like you to be in line on your back on the floor, and I'd like your legs, if your back will allow this at the moment, just to have your legs flat on the floor with your palms facing the ceiling. Okay, so if you can close your eyes. Okay, now we're going to do a body awareness scan before we start a somatic exercise. And this is just to start reading your body and noticing where there's tension. So we're going to begin at the feet. And what I'd like you to notice is, does one foot feel heavier on the ground compared to the other? Or does one foot feel as if it's dropped out to the side, whereas the other foot is pointing up towards the ceiling? At this point, you might want to open your eyes and just lift your head if you can, and look at your feet and notice if what you feel internally looks like what you see externally when you look at your feet. And then when you've done that, I'd like you to close your eyes and pop your head back down on the floor. Okay, now we're going to move from the feet, so keep that awareness there, and we're going to travel along the legs. So I'd like you to notice as you travel along the legs if one leg is heavier on the ground compared to the other. And then continue traveling along the legs to your bum muscle or your glutes. And again, just notice if one bum muscle feels tighter or more tense than the other. Or maybe they both do at the moment. And then as we're in that area, just notice with your pelvis the position of it. Does it feel as if there's a bit of a twist in your pelvis? Does it feel as if one hip is up towards the ceiling more than the other? Or does it feel as if one hip is closer towards one armpit more than the other, creating that hip hitch? And then let's just travel from the hip region to your lower back. And I'd like you just to slide your hands, both sides of your back, into the small of your back, and just notice how much of a gap there is between your body and the floor. So just notice the amount of tension in the lower back there. And then when you're ready, just bring your hands back out to the side and with the palms to the ceiling. And let's just travel along the back and bring your awareness to the shoulder blades. Okay, now how much of your shoulder blades are in contact with the ground? Would you say all of the shoulder blades in contact with the ground, or would you say that some of that shoulder blade is up off the floor because those tight chest muscles are pulling your shoulders up towards the ceiling? And then finally, let's just bring our awareness to the neck. So I'd like you just to notice, does your head position make your chin jut towards the ceiling, or does your chin tuck in? And then very slowly, I'd like you to roll your head to one side and notice the range of movement there. And then very slowly roll your head to the other side and just compare if one side feels a bit more restrictive than the other. And then when you're ready, bring your head back to the center. And then finally, just do that one all the way, scan all the way through your body. So just notice through your body if there's one area that really jumps out at you as being very tight or tense or sore. Make a snapshot of that, and then we'll come back at the end and see if it's still there. Okay, now when you're ready, I'd like you very slowly just to bend your legs so your feet are flat on the floor. And we're going to just bring some mindfulness into our breathing before we start an exercise. So again, keep the eyes closed. And what I'd like you to do is just place your hands on top of your belly, so your fingertips are touching. And what we're going to do is start taking some nice deep breaths. So I'd like you to take a nice deep breath in. And as you inhale, I want you to notice how the fingertips separate. And then as you exhale, notice that the fingertips from the right and the left hand meet again. So let's just do a few more of these. So let's try and inhale for 4 counts. And then we exhale for 4 counts. So doing this nice deep breathing starts to really slow down your central nervous system. And it's at this point that it's conducive, the brain is conducive to taking in brand new information when we're in this relaxed state. So keep going, a nice deep breath in. And allow that belly to rise, really allow that belly to swell. And then exhale. And just notice as you inhale, if there's much movement coming from your chest. So I don't want you to force it at this point, or do any time. I don't want any forcing. But just notice as you inhale and that belly rises, do we get any movement from the chest? And then let's just exhale and let the fingers come back together again. Okay, so we're going to keep this nice depth of breathing going. We're just going to start to bring some movement into the body through the pelvis. So I'd like you to put your hands on your hips. So we're just going to start to bring awareness to the movement of the pelvis. Okay, so as you've got your hands on your hips there, I'd like you to continue those nice deep breaths, but this time as you inhale, I'd like you to inhale and allow that tailbone to roll towards the floor. So as you roll towards the floor, you start to create a little arch in your lower back. And then you're going to exhale and slowly allow that tailbone to then tuck up towards the ceiling, so you flatten the back into the ground. Okay, so let's carry on and do that. So we're going to inhale. As we inhale, allow that belly to swell. When you allow the belly to really pop out, it enhances the contraction or the arch in your lower back. And then as we exhale, bring that tailbone so it starts to tuck up towards the ceiling and the back will flatten on the ground. So we're going to stay with this movement. So keep going with this movement as I talk you through a few little pointers that I want you to be mindful of. So as you inhale, I just want you to work within a free movement range of yours. So I don't want you pushing through pain. If anything feels stiff or tight, don't go beyond that, because that's your body at this point telling you, it's almost like an alarm bell, it's telling you it's going too far. So keep the movement within a nice smooth range. Also, I'd like you to remember the 4 counts in and the 4 counts out. So when we do that, we keep it nice and smooth, we keep it rhythmical, we allow the nervous system to stay nice and relaxed still. So keep going with that. Keep the movement slow. And I'd like you to also notice the sensory feedback here. So this is where if we've got the eyes closed, we become more sensitive to what's happening internally. So are you noticing if there's any jerkiness with that movement? If there is a jerkiness, then we need to smooth that out and make it a bit slower, because that's the old habitual patterns. That's the old muscles trying to take them in the old movement patterns that we've created. And we are consciously trying to control this muscle. So we want to override those behaviors. Okay, so just keep that rolling going, so nice and smooth. That's good. And I want you to also notice that as you inhale and arch that back, we contract the back of the body, and yet we lengthen the front of the body. And then when we exhale and we flatten the back into the ground, we contract the abdominals and we lengthen the lower back. And this is basically what we do when we walk or when we move. The body has been made so that when you walk and when you move, one side of the body will contract and the other will relax. That's how we function. That's how it should be. Whereas, unfortunately, nowadays, things can all be pretty solid and stiff, so that doesn't happen. Okay, so let's just finish one more of this full arch. This nice pelvic roll here. And then as we exhale, we're going to flatten the back into the ground. Okay, now this time, the next time you inhale and arch, I want you to roll into the right hip. So just take all of that rolling into the right hip. That's good. And then as you exhale, I want you to flatten the back into the ground. So again, keep it very slow. No pain should be felt. If there is, make the movement smaller again. So again, inhale and roll into that right hip, and then exhale and flatten the back into the ground. So what we wanted to do here is, as we inhale and roll into that right hip, we're going into that contraction and then we're going into the release. So we're trying to break up that habitual tightness that can be created, say on the right hip, it's from carrying children, so or other habitual patterns that we pick up. So again, into that right hip as we inhale, and then as we exhale, flatten the back. That's good. Now we're going to just add on to this. So as you're lying there on the floor, we're going to inhale, roll into the right hip. And as we roll into the right hip, I want you to push the left shoulder into the ground. So we start to create a contraction across that diagonal plane. And then as you exhale, just want you to flatten that lower back into the ground and allow that left shoulder just to relax again. So we take it out of that pushing or contraction into the floor. So let's do a few more of those. As you inhale, roll into that right hip and allow that left shoulder to push into the ground. And then exhale and come back to flattening onto the ground. So again, as we inhale and we roll into that right hip and we push that left shoulder in, notice how we get in a contraction from opposite hip to shoulder. So again, we're reintegrating a movement pattern to the muscle. We're teaching the muscle that actually when we walk, it's opposite hip to shoulder. So we're again creating a new awareness to the muscle of how the muscle and the body is supposed to move. Okay, now let's just develop it a little bit further. The next time you inhale and you roll into that right hip and you push that left shoulder back, I want you to allow your head to also roll to the left-hand side. So we start to increase the whole movement from the tailbone, along the backbone, to the neck and the shoulder on the opposite side. So again, only take it as far as you can, no pushing or pulling. We don't want to be stimulating stretch reflex points here, or stretch reflexes, should I say. That's good. So again, inhale, roll into the right hip, and then exhale and flatten the back into the ground. That's nice. So let's just finish that last one there. And then what we're going to do is focus on rolling into the left hip. So in your own time, I'd like you to inhale and roll into that left hip. And then as you exhale, flatten the back into the ground again. And this is where our mindfulness comes into play. So let's continue that. Inhale and roll into the left hip. And then exhale and flatten back into the ground. So notice, is it easier to move into this left hip here, or is it a bit more stiff and restricted? Just notice, just start reading the feedback that your body's giving you, because this is telling you a lot about the amount of movement you get through your pelvis. And it might start to explain a lot of issues that you have in that lower back, or might start to explain the limp that you have, or any other complaints in that center of the body. Okay, so continue as we inhale for 4 counts into that left hip. And then as we exhale, flatten the back into the ground for 4 counts. So we can keep it smooth, keep it slow. Notice if that jerking is appearing here. If it is, make the movement smaller again. Remember, we do not want to stimulate pain or any stretch reflexes. So it's just moving the body freely, nurturing the central nervous system. So we don't want to stress it out by inducing any alarm bell signals, such as pushing through pain. Okay, so continue rolling into that left hip, but like we did before, the next time you inhale and roll into that left hip, I'd like you to push your right shoulder into the ground. That's good. And then as you exhale, release that contraction or that pushing of the right shoulder into the ground, and then allow the lower back to flatten into the floor. And again, let's do that. So as you inhale, roll into the left hip, push the right shoulder into the ground. Start to notice again that contraction, that diagonal plane. So again, we're reintroducing contraction, release and rest, which is a movement pattern, to the diagonal plane here. So left hip Inhale, roll into the left hip, push that right shoulder into the ground. And then as you exhale, flatten the back into the ground. So just keep it at your smooth rate. I'm just prompting you here, but don't rush through your sequence. Keep it very slow. Keep it with your breath rate. And then we're going to start to incorporate the head movement like we did before. So as we inhale, I want you to roll into the left hip, push the right shoulder into the ground and allow the head to roll to that right hand side also. That's good. So again, incorporating full movement. So again, contraction, release and rest of the muscle. And again, as we exhale, we want to flatten the back into the ground and allow this right shoulder just to rest again. So we take it out of pushing it into the ground. That's good. So let's just do one more on this side. So we inhale, roll into the left hip, push the right shoulder in, allow the head to roll to the right hand side, and then bring it back to flattening the back into the ground and releasing pressure off that right shoulder. Okay, now what we're going to do is go back to the original arch and flatten or pelvic roll movement. So I'd like you to inhale and just roll the tailbone down into the ground. So we're taking the tailbone between the legs this time, so straight down the center. And then we're going to exhale and flatten the back into the ground. So I want you to notice now a real focus as we've recalibrated this movement through the pelvis. Notice how that tailbone should be going directly between the legs. So we don't want it falling into one hip or the other hip. We want it to go straight down. So we're encouraging that pelvis to move forwards and backwards. So again, as you inhale, roll that tailbone down, feel the contraction in the back of the body as we lengthen the front of the body and we start to open that tightness through the abdominals. And then as we exhale, flatten the back into the ground as we allow the abdominals to contract. Again, reintegration of movement patterns back into the muscle. So let's just add a little bit more to this arch and flatten or this pelvic roll movement. So as you inhale, roll the tailbone down towards the floor, and as you do, push both shoulders into the ground. So we really enhance that contraction through the back of the body there. And then as we exhale, I want you to flatten the lower back into the ground, and this time allow the shoulders to roll up towards the ceiling. So this time we contract the front of the body or front of the chest here and lengthen between the shoulder blades. And again, inhale, roll that tailbone down. Increase that contraction through the back of the body as we lengthen the entire front of your torso. And then as you exhale, this time we contract the front of the torso as we lengthen the back muscles. So keep going with this. Inhale and then exhale and incorporate those shoulders. So we start to increase movement from the spinal column or from the pelvis along the spinal column to the shoulders. So make it a nice full movement, almost as if you've just woken up in the morning. It's that lovely yawn and that release, that contraction. Okay, now I'd like you just to finish that last full movement there. So we inhale and arch, push the shoulders into the ground to create an increased arch in the back there, but don't overdo it. And then as we exhale, flatten the back into the ground and allow the shoulders to roll forward. Okay, now I'd like you to keep the shoulders relaxed and stop pushing them into the ground, but just continue rolling the tailbone back and forth like we did when we started this exercise. And I want you keeping your eyes closed just to notice that as you inhale and arch, notice how much more of your body is now involved in this movement. And then as you exhale and flatten the back into the ground, just notice how much more range you may have developed since relaxing and softening a lot of those deep pelvic and abdominal muscles. But I want you to notice also, as you continue doing this movement, can you feel that your head, or can you sense that your head is bobbing? There's more of a movement, or it's rocking as you roll the tailbone back and forth. So can you see that the movement in the lower back has affected muscles all the way along the backbone to the head? And so you can see whatever happens in the pelvic region has a huge effect along the back of the body and involves the head and the neck muscles too. Okay, so let's just finish that last pelvic roll or that arch and flatten there. Okay, and then what I'd like you to do is, when you finish that movement, we're just going to go back to that breathing awareness. So I'd like you to place both hands on your belly again with the fingertips touching. And I want you to become mindful, and I want you to notice how much more the abdominals have relaxed from earlier. So as you've got your hands on your belly, I'd like you to take a nice deep breath in, and as you inhale, just allow that belly to swell. And as you do, notice how the fingertips separate. And then as you exhale, they meet again. So just notice, do you feel that there's greater movement through your abdominal region now compared to earlier? So obviously we've softened, we've released the muscles. We've also started to relax your central nervous system a lot more than when we started. So this allows the muscles to just relax and release that residue tension. So again, notice. And also as your belly swells and it starts to pop out a little bit more, notice if you're getting more movement from your chest now. As we started to increase movement through the upper body, we start to release any tension in the upper body in the chest region. So that helps with our breathing. Okay, so we'll just finish that last nice deep breath there. And then just exhale and relax. That's good. Okay, now I'd like you in this position just to very slowly put your legs back so they're straight on the floor. And we're going to go back to the body scan that we did at the very beginning. Okay, so at this point here, I'd like us to keep the eyes closed again so we become very mindful, very aware of our body and the feedback. Okay, so let's just start again with the awareness at the feet. So as we lie there, do the feet still feel as if one's heavier than the other? Just notice if there's any changes or any improvement. And then I'd like you to travel along the legs and notice again if one leg feels heavier on the ground compared to the other. Or if that's improved. Does it feel as if they're a bit more even on the ground now? And then let's just bring our awareness to your glutes or your bum muscle. So with this simple movement, this very basic somatic movement, we've just started to move through the pelvis there. So just notice, does the glutes feel a little bit softer? Does the bum muscle feel it might be less tense than it was earlier? And also, what does the pelvis feel like? Does it feel more square or more settled on the floor? Or can you still feel a bit of that hip hitch or that rotation of the pelvis? And then what about the lower back itself? If we just do that measurement again, that little gauge that we did at the beginning, so you might want to slide your hands into the small of your back and notice if there's less of a gap, as it were, between your body and the floor compared to earlier, which would indicate that with all that arch and flatten technique, we've actually started to soften a lot of the muscles in that lower back. Okay, and when you're ready, we'll just bring the hands back out and put them to the side with the palms to the ceiling. And then as we travel along the body and bring our awareness to the shoulders, just notice how much of your shoulder blades are in contact with the ground. So we just started bringing a bit of movement into your shoulders in this exercise. So just notice if there's a little bit more contact there. And then very slowly, I'd like you to just bring your awareness to your head and just roll your head to one side. And just notice what that range of movement's like there. And then roll it to the other side and compare. That's good. And then when your head comes back to the center, I'd like you to notice where it naturally will rest. So is that with the chin jutting up towards the ceiling, or is it tucked in? So just notice how you feel. And then just do that final scan all the way through the body and notice if there was anywhere that was screaming out of tightness or pain at the beginning, if that's backed off slightly. Okay, and then just take one nice deep breath in and then breathe out just to finish that mindful somatic movement. Okay, now in your own time, I'd like you just to roll over onto your side, or however it's the best way for you to get up in a very controlled, careful manner, considering with your back and your body generally. And then just sit up in your own time. Okay, now This is a very simple somatic movement. In this Total Somatics program, there's lots of other movement sequences that we do to target all sorts of shoulder issues and back issues and hip issues. So I just wanted to introduce you to one of the main movements of the pelvis, because obviously when we get tightness through the center of the body, it affects everywhere else in the body. Okay, so if you ever wanted to play back this exercise, you know, on Facebook or on YouTube, it's brilliant because it's a great way just to start your day, or for some of you in the Northern Hemisphere that are watching, it's a lovely way to finish your day because obviously we've slowed down the nervous system. It really is nice to prepare you for the evening and for bedtime also. Okay, so if you're all happy to come and sit next to the computer, please do again. But I really hope you've enjoyed today's session. It's been really lovely to speak to you. And in this very short time that we've been talking and that I've talked you through a somatic exercise, you've already started to change the neuroplasticity or the wiring in your brain to make these movement patterns happen again in your body. So I'd really love you to visit totalsomatics.com and learn more about the online program so that you can do it and you can empower yourself with the skill and also increase your knowledge about your body and also about mindfulness, because it's so important in our day-to-day lives for our mental, physical, emotional and spiritual health. And just remember, with Thomas Hanna, he created somatics, and that was not just to deal with the mind or the body, but it's to deal with the soma, the whole being. So we're pretty complicated beings, but we're very intelligent beings. And so the more that we start to recognize and work with our own body and adapt in different environments, the more we're going to get out of life, and we're going to help our bodies to recover and recuperate, and we can nurture them so much more with a greater understanding. So somatics is a great neuromuscular therapy, and I'd love you to tell as many people as possible. So remember, totalsomatics.com. It's got everything that you need on there, so please do have a look. Please leave a message on my Facebook page. I'd love to keep in touch with you all. Lots of questions, please throw them at me so that the next Facebook Live I can again bring more information to you that you really need. Keep in touch. I really look forward to seeing you again next time. So thank you for joining me and take care. See you soon.